Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today, infectious disease epidemiologist Dr. David Dowdy returns to the podcast to talk about what we learned from last year's flu, RSV, COVID tripledemic, and what we might see this year. We'll also talk about how new vaccines and treatments like the game-changing antibody that protects kids from RSV are entering the mix. Let's listen. David Dowdy, welcome back again to Public Health on Call. It's good to see you. How's your summer?
It's been great. Thanks for having me back, Lindsay.
Yeah, sure. So it's July, but we're already thinking ahead. We're talking about the 2023-2024 flu RSV COVID season. And the narrative that we've sort of had is that last year was this big unprecedented viral respiratory mess after a couple of years of not seeing as much flu and RSV. And we've talked before about the reasons for that. But a lot of us are a little on edge about maybe another difficult season. So can you help us put last year in perspective?
Sure. So I think people have, a reason to be on edge. The COVID pandemic threw us all for a loop, and I think no one really knows what to make of respiratory viruses anymore. I think that, last year we did have quite a large spike in RSV, and the flu season was earlier than usual, but not necessarily worse than usual. And so it's hard to know exactly what's going to happen this year. But given that COVID, at least hospitalizations and deaths are at all-time lows, and people are getting back to behaving as they did before the pandemic, I think it's likely that we're likely to get back to the way things used to be with respiratory viruses as well.
So do you think that could happen this year?
I think it's possible, yes. Anyone who says that they're able to fully predict the future when it comes to these sorts of viruses, I think is probably a little bit overconfident. We don't know for sure what's going to happen, but we don't have any evidence to strongly suggest that things are going to be much, much worse this coming year than they have been pre-pandemic, for example.
I want to go back to what you said about this being the all-time low of COVID. Anecdotally, I know someone who was sick with flu and COVID at the same time last week. And I was like, wait, flu in July? We've seen some reports of a little bit of an uptick of COVID and some wastewater surveillance. What's going on here?
Yeah, so we are seeing a slight uptick in wastewater surveillance, but I think it's important to couch that in probably more meaningful data on hospitalizations and deaths really being at an all-time low. They're stable. They're not going further and further down, but they're not really picking up. Both of the last 2 years, we saw a noticeable summer peak in COVID admissions and deaths. And we really aren't seeing that at all this summer for the first time since the start of the pandemic. So I think that's overall good news. So people may still be getting sick, but they're not getting really sick.
That is really good news. And could it possibly be that we're sort of in between what I'm going to call vaccine cycles, where a lot of us that got the bivalent booster last year haven't gotten a vaccine since and are maybe waiting for the fall for the monovalent vaccine to come out. We also just had the 4th of July where a lot of people were gathering. Could it be that that's why we're maybe anecdotally hearing about more people getting sick?
Yeah, I think that that's certainly possible. I think that a fair amount of immunity to COVID-19 now is due to people having gotten sick themselves, not just the vaccine. And I think that's providing some ongoing protection now. But I think that certainly we've seen this both of the past two summers as well. There was a big surge in the winter, and then a smaller rebound right around this time. Which again, we're not seeing in terms of serious illness, but in terms of cases, we might.
And one other thing I want to ask you before we go on to talking about the flu season this year is that, it seemed like part of the narrative last year was that people were just sick all year long. There was like strep, going around in March, April, and May. I know that especially for families with younger children, it felt like someone was sick at any given time. So is that sort of part of this coming out of COVID? And do we think we might see that again this year?
Yeah, so I think there are probably a number of factors at play here. First of all, I think there is some component of coming out of COVID. I mean, you think of how we were acting a year and a half ago. Lots more people were wearing masks. People were still distancing themselves, I think, much more than they are now. There was this added layer of behavioral protection. And once that has gone away, these viruses that have been with us, for centuries came back. And since there are many of these viruses and they don't all talk to each other, right? So you'd have one wave of one sort of virus and then another wave of another. And so people would feel like they were always sick. This is even more true for young kids. So for example, those who are infants during COVID season, they never had that opportunity to build up that first layer of protection. There is also, of course, I think, a component of if you ask any parent who's had a kid who's been in daycare, even before the pandemic, you're always a little sick, right? I mean, you have kids coming in and infecting each other and then bringing those things home. And that happens in the summer as well as during the winter. So there's probably an element of that as well.
So what you're saying is that humans are going to be humans and viruses are going to be viruses. We're just paying a lot more attention right now.
Yeah, I think that's true. I do think that there's still the fact that during the pandemic, we were slightly different humans. And so we didn't have quite as many of these viruses circulating. And so it took a little time to get back to our usual ways. But I think we're pretty close to being back there now.
Well, let's then talk about this early flu season because, every year I wait until November to get my flu shot because I want to have that protection, through the winter and into the early spring. But that might not be the best advice this year. What do you think?
Yeah, so interestingly, the advice hasn't changed. The advice has always been to get the flu shot in September or October. Before the start of the flu season, and the flu shot is designed to give protection throughout the season. Those who participate in mandatory flu vaccine programs, so healthcare workers, et cetera, are used to getting their flu shot in September to October. But I think given the fact that we had this early flu season last year where the flu really spiked in November as opposed to January, February, like it usually does, I think it's probably a little more relevant now. We probably are a little bit more likely to have an early flu season this year too. Again, just because the last flu season was pushed early too, and it might take another year or two for us to get back to the usual way of things.
All right, so let's talk about the third virus in our sort of trifecta of the tripledemic, which is RSV. And we had some big news that just came out. There is a new antibody for RSV. Can you tell us a little bit about that?
Oh, yeah. So the FDA approved a new antibody for RSV. It's called nirsevimab. This is the second antibody that's available for protection against RSV. But unlike the first antibody, this one lasts longer. So it's been designed to be stable in the body for like 4 to 6 months. And it's been approved not just for those infants who are at highest risk, but for all healthy infants as well. So we're expecting to see a lot more uptake of this antibody, and hopefully that will help protect our youngest infants against RSV a little more this coming winter.
And so I want to close us out here with just sort of a broader perspective. Like, we know that, okay, it's July. We know that we got to start planning ahead for September to go get our flu shot, maybe even our COVID monovalent shot. And then, ideally, whoever is eligible gets an RSV shot in there too. We go through this next viral respiratory season. And, ideally, I think you mentioned before in an offline conversation, like, yes, COVID deaths and hospitalizations are down. We did see a significant flu season last year, but you said it wasn't anything crazy off the charts from what we've seen before, but with the caveat that all of the hospitalizations and deaths are to some degree preventable. So what's sort of the through line here?
Well, I think the through line is to get your vaccines. It's true that we're seeing hospitalizations and deaths due to COVID-19 declining. And for the first time, really, since the beginning of the pandemic, we're seeing all-cause mortality starting to normalize. So all of this is good news, but we have to remember that these are still deadly viruses. Tens of thousands of people die from COVID and the flu every winter, and that's likely to continue being the case. And so just because we're coming out of the pandemic doesn't mean that we're suddenly immune to these other viruses. And we need to continue to do what we can to prevent those viruses from taking hold. And so that means getting your flu shot when it's available, getting your monovalent COVID vaccine when it becomes available, getting your kids, your infant children, these new antibodies for RSV. And if you're indicated to get an RSV vaccine yourself, the way that we prevent the brunt of deaths from all of these viruses is to take each of these different steps in tandem and to do it as a society.
Well, David Dowdy, thank you so much. It's always a pleasure to have you on the podcast, and we will surely check in with you again soon.
Thanks so much for having me, Lindsay.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.